Hi guys, Kyla Hargraves from Bijoux Med Spa. I'm back to talk about what happens in our 50s when it comes to aging. It's basically everything that happens in our 40s, it just continues to progress. So this means that our skin is continuing to thin out. We are losing collagen and elastin still. We continue to lose bone. Our orbital eye sockets continue to get wider. Our maxillary bone continues to regress. We lose the angle in our mandible. It starts to regress up this way. And so zygomatic bones, they're flattening, so we're losing our bone. Our fat pads are continuing to shift down. We're losing the deep, youthful fat pads. Granted, we can gain the superficial ones, but everything's shifting down. So it's about maintaining your structure, replacing volume, and keeping your skin, your dermis, in the best shape possible. A lot of the things that I mentioned in the 40s decade video and the recommendations there are going to be carried over into the 50s. So things to help your dermis. Once again, things like microneedling. Regular microneedling does so much for your skin. Doing that at least a few times a year. Maybe switching over to RF microneedling and doing that once to twice a year. That's a little bit more strong than regular microneedling. Doing resurfacing laser treatments, maybe getting one of those done in your 50s. Getting things done like BBL to help erase the brown spots, keeping the broken capillaries at bay. So that helps keep our skin healthy as well. I mentioned that there's been studies done doing light-based laser procedures such as IPL or BBL really helps your skin age slower. So getting a couple BBL treatments a year, helpful. During your annual consultation with your aesthetic provider, make sure that you are bringing up your skincare routine. I always do that with my patients. We're always reviewing their skincare routine on an annual basis, making sure they're on the right products because things change over time. Your skin can become more dry. It can become more sensitive as we get older. We don't make as much oil. So things will need to change in your skincare to make sure that you are keeping your skin barrier as healthy as possible and that you're doing everything you can to maintain your precious collagen and elastin within your skin. Also, making sure you're still doing your quarterly facials. That's going to do a ton to help you maintain a healthy skin barrier and helps between your bigger treatment appointments, such as your laser treatment appointments or microneedling appointments, to help maintain those results and improve your results. So make sure you're getting your quarterly facials still. So now let's talk about what you could do to continue supporting your structure and volume as you get older. So I mentioned before, fillers, a quick and easy fix to add some volume back in different areas in your face. I love Renuva. Renuva is an alternative for a fat transfer if you're not ready for surgery yet. And then Sculptra, of course. I think in your 30s, everybody should start looking into Sculptra. It's a biostimulator. It's going to help you maintain your collagen. But as we get older, we don't make collagen as good as we used to as when we were younger. So instead of 1 vial a year of Sculptra, the 50s is where you might want to do 2 vials a year here and there to help support your collagen growth and structure. And then in your 50s, this is where a lot of people start considering surgical intervention. There's only so much that we could do with non-invasive procedures, such as fillers or biostimulators or devices, before you can potentially look overfilled or overdone. And this is where a good facelift or neck lift can really make a difference. However, I understand surgery is not everyone's cup of tea. So if it's not, there are other skin tightening devices out there that aren't going to tighten and lift you as good as surgical options, but it's still an option nonetheless outside of surgery. And those are skin tightening treatments such as Everest or some of the more hardcore treatments like resurfacing laser. Both of them actually work beautifully together. So if somebody's not ready for surgery in 50s and beyond, then we start talking about a strong resurfacing laser treatment with a skin tightening treatment such as the Everest. At Bijoux Med Spa, we've curated packages based on your decade of life, your skin color, and what your goals are. So if you have questions on any of this, I encourage you to schedule a consultation with us, or if you're not around us, with a trusted provider in your area. Please feel free to reach out with any questions that you may have as well.